people to abide by the guidelines?
I mean, that's absolutely right. This is about common sense. We are not going to be setting up, border checkpoints. We have worked from the very beginning as one United Kingdom police service, whether it's Northern Ireland, Scotland, the forces in Wales or in England. We've all worked together. We've all tried to apply the rules as the rules have been. There are now the differences, obviously, between the four nations. But policing will carry on. It will adopt the same style. Of course, there will be people who are legitimately crossing the border to go to work for other reasons. But I would just say to everybody, think really carefully about whether it's reasonable to cross the border for recreation or for sport, and understand what the rules are in the country that you are entering. And we will obviously, as I've said, engage with people at every opportunity to explain the rules if there's any confusion, and then encourage people to return home if that's appropriate, if they're not using one of the legitimate reasons to be outside.
Martin Hewitt, Chair of the National Police Chiefs Council, thanks very much for your time again here on BBC Breakfast. Thank you.
Now, a couple of months ago, any parent of a sick or injured child wouldn't have thought twice about taking them to hospital if it was necessary.
Now, fear of coronavirus is causing them to stay away, with Addenbrooke's Hospital in Cambridge seeing less than a third of the usual number of young patients. Our science correspondent Richard Westcott has more.
There are plenty of staff on shift and all the safety measures are in place. But at this hospital, like many others, staff say fear of the virus is stopping parents bringing their children in.
It's a lot quieter. We've got empty beds for the first time in paediatrics. We've not had empty beds for a long time.
I mean, you're a nurse, but you're also a parent. Can you understand why people would be worried, reluctant?
Totally understand it. And we've discussed it with my colleagues and we've said, what would we do if our children were sick? And we've all gone, I don't know. But we all know that the right answer is to seek medical help when medical help is needed, and that we would bring our children in.
Keep your eyes still. Keep your head still. Right now, look at the fingers wiggling. That's it. Well done. That's brilliant. Fantastic.
They'd normally see 80 to 90 children a day at this time of year. They're currently seeing around 20 to 30.
Antibiotics, okay, yes.
I didn't want it.
I didn't want
it. Yucky.
Including Abigail, whose mum was nervous about bringing her in.
I was watching the news, very scared of the number of people dying and all that, but then we had to come in.
And you're glad you did it?
I am very pleased I did. I brought my daughter in and she's getting much better. If you had seen her 9 weeks ago, you would understand that she's much better now, because I know she's in good hands and in a better place.
Initially, we were expecting a tsunami of coronavirus cases. And in fact, what we've seen is a different problem. We've seen children presenting later and sicker, some to our intensive care unit, because we think that parents are worried about presenting to hospital in the middle of the pandemic.
There's another problem too. COVID-19 doesn't tend to make children very sick, but sepsis, appendicitis and pneumonia do, and the symptoms can look the same as the virus.
If a child is seriously ill with a cough or fever or other non-specific symptoms such as abdominal pain, it probably isn't coronavirus. And the key is that we want those children to come to hospital as soon as possible.
That's what caught Natasha out. Her son Jack has a rare genetic condition, so they're used to hospitals. He's recovered now, but a few weeks ago he became very ill with what even the doctors initially thought was coronavirus.
We went the whole week thinking, no, this is COVID. We'll ride out another day. A day of sunny spells around. There will be a little bit of